one of our aims is providing technology that not-for-profits can use to deliver basically greater impact. And one of our offerings is a product called SRS, which is a client and case management system. A lot of homelessness services also use SRS under the name SHIP across the country as well. So some of you may be already familiar with that application. And basically we've customised SRS in collaboration with the Sachs Institute to collect the information that you need to for the FDSV pilot. And so today I'm basically going to be walking you through the user guide and what SRS looks like and how it works. And then hopefully once everything goes live, you'll be able to then use that for your data capture as opposed to the spreadsheets that you've been using so far. So what I'm going to do now is share my screen. Okay. Everyone give me a thumbs up if you can see the browser at the moment. Brilliant. Okay, so we'll start off with if you do have multiple screens, this is the user guide that Sally's kindly sent through, which is basically what we're going to be running through today. And that also has screenshots from SRS, which I'm about to demonstrate now. So just to reiterate, the system will allow primary health networks and FDSV service workers to record the support provided to primary care organisations within their region as part of the pilot. And that will help inform the evaluation by providing an understanding of the nature and amount of capacity building activities delivered in each of the participating primary health networks. So I'll first show you how to log in. So SRS is a web-based system. So basically you just have to open any sort of browser, Firefox, Edge, Chrome, and basically type in the URL. The Sachs Institute, their IT team are going to be managing user access, and the user guide provides some instructions for how to request user access. So when you get set up, they'll basically send you through the URL. And this will take you to a welcome screen here. So you'll be provided with your username and password. You also see on the screen here, if you need any help, so our SRS support team, they have a helpline based in Melbourne. So it's on Melbourne hours. And there's also have a email support here. So if you're having trouble logging in or something's going wrong in the system, you can contact them or alternatively contact the Sachs Institute, and the details are in the user manual there to get some support. There's also links to an online help website, a feedback page, and if there's any development or changes being made in SRS for the overall product, details of those development requests are also in the SRS news page as well. So without further ado, I'll just try and log into the system now. So you'll enter your username and your password. Click sign in. Now there's two-factor authentication on this application. So a verification code will be sent to your email address. Just give that a minute or two to arrive. And we're now logged in. So when you first log in, you'll be prompted to actually change your password, because obviously that's a password that's been provided by someone else. I want to save that, of course. Sorry, guys. It's always the most challenging part, logging in. Go. All right, so now I've changed my password. The next thing that's really great to do is actually update your security question, which means that if you ever forget your password, you can reset it yourself without having to contact the SACS Institute. So you navigate to the Preferences tab. So just so you're familiar, when I say page, I'm referencing any of these options on the left-hand side here, and any tabs within each page are any of these tabs along the top toolbar here. Now, if you have any questions, often they're answered on the SRS online help website, and you can access that within the application by clicking on a little question mark icon here. So I'm going to put in a security question here. What are the last 5 characters of my driving license? Ordinarily, I want to put 4 or 5 zeros in there. What that means is that if I forget my password, on the login page, there's a reset your password link. And what I would do there is I'd put in my username and my email address. It'll send me a key that I can then input into the login screen, and then it'll ask me what the answer to my security question is, and from there you can reset your password. So that's that there. Now, if you ever want to log out, this is the log out icon at the top here. Your role, there's a couple of roles that will often be used in this implementation. So most people will be a normal user, and then some will have coordinator access. Coordinator access can manage user access and also run certain types of reports as well. Normally, you'll only have access to a single work group, and I'll understand what a work group is in a minute. But if you have access to multiple work groups, there's an option here to change which work group you're in. Anything else that I need to go through on this page? Nope, I think that's everything. Okay, so we were talking about the concept of work groups, which in the user guide is explained here. So each team or service is called a work group. And when you log into the system, you see all of the information for your work group. And in this implementation, a work group represents a primary health network or an FDSV service. And a cluster, your work group will belong to a cluster, and a cluster represents basically a grouping of FDSV services within a PHN. Yeah. Okay, so there are a couple of pages I want to talk through. So we've got the home page. So this is what when you first log in, where you'll automatically navigate to. It has a couple of different lists, which we'll go through shortly, for managing planned activities. This page here called Practice Personnel, this is where you create practice personnel records. So these are, for example, your GPs and your nurses and your physios that you may be working with, for example. Practices and services page, so this is where you enter details about the practices or services that you engage with and record details about the nature of the engagements that you've had with them. The reports page is where you can run out-of-the-box reports and lists. And we've also got a custom list that's being developed, which you'll basically be able to run and provide to the SACS Institute for the evaluation purposes. And then the admin page is where you manage your passwords and your security questions. So the first thing we want to do is look at creating a practice or service record. So this will need to be done the first time you engage with a practice or service, unless you're in a PHN who has already created a record for that. So we'll navigate to the practices and services page first. Now, we're in a training work group 1, and that already has a number of practices and services that have already been created. So the first thing I would do is basically search the list to ensure that they don't already exist. So I can tell that it doesn't in this case. So I'm going to create a new practice or service record. You can also, there is a filter available so for example, there's only 18 results here, so you can see it all on one page, but I imagine there might be a lot more services that workgroups will be working with. So if it does paginate, you can search using the filters as well. So I want to click create new practice or service record. And there are a number of mandatory fields on here. All of the mandatory fields have an asterisk next to them. So if I click save here, we'll basically just get a list of all the mandatory fields that need to be completed. So identifier code, you can't enter into this field, it's automatically populated. So have a name. Does anyone have a, let's do surgery. Put the solo GP, current engagement status. This is basically how the practice or the service is engaging with you at the moment. This practice or service record may be updated by all the different work groups within your cluster or within your PHN. So it's just important to note that, you know, although your service might not have been yet contacted the practice or service, others may have. So that's just something you might need to work with the other work groups to understand. So I'm going to say contacted, awaiting response. You've got the date the service first engaged. That will default to today's date, but you can backdate it using this little calendar icon if you need to. And then you've got the address and contact details. So the state should automatically default to the state that the workgroup's been set up in. I'm going to change it to Queensland for this example. And put in the address of the practice or service. Writing that. And then we've got the service provider private notes as well. So it's important here just not to include any client identifying details in these free text fields here. So I've now completed all the mandatory fields here. I want to save this record. And you'll see that Albany Creek GP surgery now appears in the listing. Okay, if I navigate to the practice personnel tab here, you'll see now I can record the type and number of personnel in the practice. So this is inclusive of people that you're actually engaging with as well as others. So I'm going to say there's 1 GP and 2 receptionists and a nurse as well. And also a field to record where the source of information is from. So it might just be an estimate. Then save that record. Now what we want to do is create a practice personnel record that we're actually engaging with to associate with this practice or service. To do this, we can first search if that person already exists. So to do that, I click on this plus sign here. Click on search. I'm going to search for myself. See if I'm in here. Click on go. And no one returns my search, which means that that person isn't already in the system. If you already have accessed them, they should be in your recent list here. But again, I don't have any examples. So what I need to do now is I need to navigate to the practice or personnel page and search for the person I want to add. It doesn't return any results. If I put in, for example, put in a wildcard here, I can use the percentage mark basically to identify, bring back everyone. If I click search here, that brings back a list of all the practice personnel that are in the cluster. Obviously, I'm not in there, but you can sort of scroll through here if you're unsure of the naming of the person or not. So I want to add a new practice personnel member, and all I need to add here is the first name, last name, and the sex. You can disregard all of the information here. So relationships, profiles, address, phone and other contacts, key workers, none of it is necessary. SRS is a client engagement management system, and we've basically used the client record to be able to record your GPs and nurses and the people that you're working with in those practices. And I'll come back to what we can look at on the contact log and the planned activity tabs here. So now that I've added that practice personnel member, I want to navigate back to my Albany Creek GP service on the practices page. So open up the record. I want to click on this little blue underlined hyperlink. And that'll open the record again, and I navigate to the practice personnel section, and I want to say that I'm actually working with Ruth in this example. So you can see, because I've already accessed that person, they now appear in my recent list. Click save there. That person is now associated with this practice or service. Now, when I save this record, I'll get another prompt just to say, please assign a role to the following practice personnel. And if I click on this little red pencil here, I can then select what sort of role that person has within the practice. So I'm going to say I'm a receptionist here and save that. Now, the start date of that person automatically defaults to today's date. You can backdate it if necessary, if you want to basically say that you've been engaging with that person since an earlier start date, but at the moment it doesn't really impact anything, so you can just leave it to default to today's date. You can also add free text here if that's important, if there's anything important you want to note about their association. Okay, so now you've created a practice and service record, and you've created a practice personnel member, and you've associated them with the practice and service. Now we want to create a contact log record. So a contact log is basically a distinct record that should be created every time there's a meaningful engagement with a practice or service or with a referred client. And if a meaningful engagement involves multiple practices, for example, a webinar, a separate contact log will need to be created for each practice or service involved. And as a user in one work group, you can see the full contact log records that were created within your work group. You can't see contact log records that are created in other work groups within your primary health network or site, unless they specifically share that with you. So I'll just demonstrate now how to create a contact log record. So you want to click on this little icon here next to the GP, the practice, and click create new contact log. Just increase the size. So again, all of the mandatory fields have an asterisk next to them, and depending on the choice that you make in some of the questions, additional data sets will become available. So I'll just save the record to show the following fields. These are the mandatory ones. So the first field you'll see will automatically default to be the linked practice or service record that's linked to this contact log. The date of contact, that's the date that you actually had that meaningful engagement and can be backdated using the calendar icon. Delivery mode is how you actually delivered that engagement. So, for example, phone call, email, etc. And then you've got the practice or personnel members involved. At the moment, this just defaults to be all of the people that you've associated with the practice. So you can add more than one, obviously. There is a little investigation piece at the moment to see if we can automatically unselect all of these people, and then you go in and select them, because there are obviously cases where you may have 30 people that you're engaging with a practice or service, and it would be more difficult to unselect them than select them. So we're just investigating what's possible there. The next field is the FDSV workers involved. So this will automatically default to the user that's created the contact log. You can add other users here. So by clicking on this little blue person icon, you can look in your own work group and see who else you want to add in to say that there's other people have participated. So Alice, this is an example here. I can add Alice as well. If I want to remove anyone, I can also click a little cross. And if I want to add someone that's not necessarily a user within this work group, I can select external organisation and then type in basically the worker. So add, close. Okay. The next field is the duration of contact. So this is how long you spent on that meaningful engagement. So contact time would be direct, face-to-face time or on the phone, whatever that may be. So 10 minutes in. And then casework would be the time that you spent prepping for that meaningful engagement, and travel would be time traveling to that meaningful engagement. So I'm just going to put 10 minutes in contact at the moment. Just making sure that I'm covering everything in the user guide that's relevant. Okay. The next field is who initiated the contact. So this is either FDSV team or the practice or service staff. And then we've got the nature of contact. So all of these options more or less will create an additional data set that you need to complete. So I'm just going to show you by ticking all of these options, or the majority of them, you'll see that other tabs become available. And within these tabs, there are extra fields about that nature of contact, and we'll go through them separately. And then there's 3 free text fields at the bottom here that are not mandatory, but there's some basically to record any contact highlights or challenges that are suitable for sharing with the Primary Health Network or the Sex Institute for evaluation purposes. And then each service provider private notes. So I'm just going to untick those to begin with, just save the record. Contact, okay, relationship stored in. Now we were talking about who can see this information. So by default, it's only the work group that's creating the contact log note, but you can change that. So if I click on this little icon here, I can they can see that the record exists, but they can't see the details within it. I can actually share with other work groups. So within my cluster, so within my same PHN. So there is a training work group 2. And what I can do is select training work group 2, click on this little blue plus sign here, and I can see, I can allow that work group to read the contact log that I've created, that specific record, or even edit the contact log record as well. So there are options there for sharing this information. So for this example, I'll just do read, and I can demonstrate what that looks like in training work group 2 a little bit. Okay, so we'll go through the extra data sets depending on the nature of contact that's been selected. So there are lots of mandatory fields depending on which ones you've brought up. So relationship building, here we've got a number of optional fields to record the number of practice or service participants in the activity. This is just a select field with a number. You don't have to complete the field. You can leave it as please select if it's not relevant. Then we've got a resources tab, and there are 6 options for you to add resources that have been provided. So resource name. So all of these are all options that the PHNs have provided to Sally as a listing, and you can search for your own PHN to bring up the list that you've provided for resources that are available that have been provided. So for example, PHN, that will just bring up all the list of options available to that PHN. There are some other options. So other is also an option, and if you select other, you can specify by putting in some free text into the next field. And then you've also got number of resources supplied. Where there's a resource that's shared across all PHNs across the country, you can just search by name. So for example, I think it's strengthening GP resources responses. There's a couple of options there that are shared across the country, so you can select that there. Again, only the first resource is actually a mandatory field. The remainder of them are optional. If I go to the training tab here, training name, that works the same as resource name. You can search by your PHN, or you can search by the actual name of the training that's been provided. If there are new options, the SACS Institute have the ability to add those options themselves, so you just have to send through a request to them and they can add it into the listing. And again, if you select other, there'll be a free text field to record what that is. And then you've got number of practice and service participants in the activity, and again, this is just a select field with a number. And then you've got the QI CB tab, so this is a QI or capacity building, and this name field works exactly the same. You can search by PHN or search by the name of the capacity building activity. And then the number of practice and serve participants in activity. Again, a repetition of how many have been participating in that QI or capacity building activity. You've then got an FDSV tab. So this is a multi-select field, so the nature of advice. And if you select other, again, there's a free text field to record what that would be. Same here. Any priority population focus, this is a free text, not free text field, a select field with an other option, with again a free text field to record that additional information. Did the contact result in any immediate referrals or referral recommendations? Now, depending on this selection, other fields become available. I think it's if any of them are yes, then these new fields will become available. To what types of services? Again, that's a multi-select field. Is the service or are the services part of the FDSV pilot? Yes, no, or combination. We've got a checkbox across here. And then number of practice or service participants in activity. Again, that's just a drop down to select. And then we've got the direct referrals tab. So again, this is a multi-select checkbox. And then these are select fields for recording whether or not the referral was made via an action plan, if it's a new or returning client, what the gender of the client is, the client age, number of children, whether they're First Nations, cold, disability, etc. And then you've also got the referral outcome. So I'm just going to fill in some of this information here because it's all mandatory. And we've also got a non-mandatory field or optional field here at the bottom called triage priority. In the user guide, I believe it has examples or explanations for what some of these fields mean and things like that. But if there's any questions, the SACS Institute can probably provide some further explanations. But I think a lot of this is already data that you're capturing in those spreadsheets. So that's a mandatory field I haven't completed, which was training name, please specify other. Okay, and I save the record. Now, every time I save the record, you'll see the last update as being my user, which work group I'm in, and then the time and date stamp of basically when it was last updated. And that will continue to update as people go through and save that record. Okay, just so you're aware, on the details tab here, if I tick a nature of contact, fill in the information on that tab, and then untick it, that information will then be cleared from that tab. So basically for data integrity purposes, just important to know that if you fill it in and then untick it, it's going to clear all the data that you've already entered. Okay, Sally, is there anything else you wanted to add about contact logs before I move on to planned activities?
No, I think that's all great.
Okay, cool.
Thank you.
All right. Next, we are going to create a planned activity record. So this is entirely optional and none of the information will be used in the pilot evaluation. So a planned activity is basically a distinct record to record that you've got a planned activity with one of these practices or services. So it's very similar to a contact log. You click on this little icon here, click create new planned activity. And the fields here are a lot more simple. So we've got the date that you plan to do it. So normally it's in the future. So I'm going to put it towards the end of this month. You can put in a start and end time if that's appropriate. So I might say I've got a meeting 1 and 2 and the nature of the planned activity. So I've said basically I've had a phone call today with the receptionist. I've set up an introductory meeting with the GP. Then I've got a free text field to record what the details of that planned activity are. Which of those practice personnel on the practice and service you've actually going to engage with. Works the same here. So Ruth Cook, I can unassociate if I want to. The FDSV service workers involved, again, I can add more users from the work group or others if I want to. And I'll save that record. Now, if I go back to the practice or service here and click on this little icon here, you'll see basically a list forming of the records that I've created against it. So the contact log I just created earlier and the planned activity. Obviously, as this list grows, if you want to search for any information, you can use this filter in here to search for within a specific date range and also a specific record type, so contact log or planned activity. And there's some sort of a summary of information within this notes section here. So for the planned activity, that will be what the free text field was. And for the contact log, you've got the work group that it was created in, and basically the nature of contact that was selected, but no further information. If you want a bit of a summary about what's on that contact log, you can hover over this little eye icon and that'll give you a bit of an overview. Alternatively, you can just navigate to the contact log and edit it as you need to. Now, with those planned activity records, you can basically see a summary of them for all of the planned activities entered within your work group that have yourself assigned to them by navigating to the home page. and the My Actions. So you'll see here that the 30th of April at 1 p.m, I've got a task to talk to the GP, and I can navigate to that task by clicking on this little blue hyperlink here. I can also mark it as complete if I need to by just clicking on this little checkbox here and marking it as complete. If I do that, we'll basically put a date against it's completed or closed here. There's an outcome basically just to say if it was completed, cancelled or rescheduled. So that's just a way of managing the planned activities that you've got coming. Now, the contact log record and the planned activity records that I created for Ruth Cook, who's the receptionist within the Albany Creek GP, I can navigate to Ruth Cook's record. So I can either do that by navigating to her through the recent list, which is on the left-hand panel. These are all the latest 20 clients or 20 GPs or nurses or whoever you've entered that you've actually looked at. Or I can navigate to the practice personnel and just search for that person. Give you some options here. So the contact logs that have been created for that person will also appear on the contact log tab here. You can't create any new ones from here, but it just does give you a way to view them. And then also the planned activities as well. There's also a calendar view. So if you want to look at this rather than in a calendar as opposed to a list, you can do that here. And again, just navigating using the arrows to go through the different months, etc. There's a filter as well. Let me just check that I've covered everything so far. Okay, so if you want to close a practice or service record, if you navigate back to the practice and services page, click on the record, you can put an end date, say today, and then the current engagement status should be changed to service permanently closed. And that basically just provides enough information to the other users that that record shouldn't be used anymore. Is there anything else you wanted to say on planned activities, Sally?
No, it's really that I guess that whole thing is entirely optional for if people want to use it. It was created because it was a request from some sites in the early sort of consultation process. So the only other bit is that it is a little bit limited in that it can't send you alerts or things like that about tasks. So if you wanted to do that, you might want to sort of add something in your own calendar as a reminder that might pop up a little bit more actively. So you do need to have a look at the list to see what's there. That's the only part of that.
Yeah, okay. Now I'm quickly going to just demonstrate what, if you share a contact log record with another work group, what that looks like to the other work group. But for that, I just need to quickly make a small change to my access. So I'll give you 2 seconds. myself to give myself access to the other work group. Only blame the baby. Okay. So as I demonstrated earlier in the contact log that I created, I'm in training workgroup 1, but I chose to actually share this information with training workgroup 2. So I'm now going to change my workgroup. I've actually got access to both of them. And you can see I can see all of the practice or services because I'm within the same cluster or PHN or site. If I open up the same record here, I won't be able to see any of the planned activities of the other work groups. But I can see a read-only version of the information that was entered by the other work group. Now, if that information hadn't been shared, what I would see instead is, for example, basically a prompt to say that the record has been limited, and so further information must be made through the work group that created the record. So here I can see that training workgroup 1 has created this contact log record, but I can't see the information about it. So I'd have, if I really did want to see what it was about, I could have to contact that work group and ask them. And they might be able to then update the share and permission on that record to basically allow it to be viewed by you. Okay. I think we're ready to move on to reports and lists, Sally, unless you have anything else you want to cover, or do you want to cover the questions about the actual data entry first before we move on to reports and lists?
No, let's do the reports and then we can have a look. There's not too many questions so far, so I think you're doing a great job of it.
Thank you. Okay, so there are a couple of out-of-the-box reports and lists available to get this information out that you've entered. So you can do this by navigating to the Reports tab. Actually, let's navigate back to the training workgroup 1 first. That might be a better idea. So we've got a contact report. That's the only one that's currently available. If you've got access to more than one work group, you can change the work group that you're running it for, but obviously for most people that will just be one. So I'll leave that as is. The contact report basically aggregates data from the contact logs that you've entered. And included in the report, there's a number of different filters that you can use. However, as stated in the user guide, the only one that's really going to be useful to you is persons with a recorded contact in the report period. And by that, it means practice personnel with a recorded contact log within the report period. And then you've got this exclude file note. You can disregard this field completely. And then you've got your period of interest, which is basically your report period. There's a number of preset options here which will automatically change the start and end date, or alternatively you can use the calendar icon to select what you want to. So I'm going to say let's do today, and that should bring back the information from the contact log record that we created for the Albany Creek GP. Click on generate report, That'll give you the ID number here, so 1203. And to access that report, you can then navigate to the results tab. I find sometimes if it's taking a little while to process, if you click on the tab again, sometimes it refreshes it a little bit better. So on here, you can see all of the reports that you've ran. If you want to see all the reports that everyone in the work groups ran, you can click on this All Reports option here. And that'll basically bring back a list of everything that's been run generally. So the latest report will always be at the bottom. It's got the date and time it was ran, who ran it, for which work group, what the report name is, what the report parameters were. And there's also an option to delete it or view it. So I'm going to view this one here. And basically it just aggregates the information from the contact log. If there are multiple practice personnel associated with that contact log, for some parameters, it will then, for some data sets, it will then duplicate that information. But generally speaking, there's a description of how each of these tables are counted. So, for example, distinct persons would be if there were more than one person on the contact log. So a Ruth Cook and a John Doe, that would be 2. And then distinct contacts would be 1 because it's a distinct contact log. So yeah, all of the fields that are on the contact log that are structured, and by structured I mean not an integer field or a free text field, there should be a table that then aggregates all of that data going down. Now, these reports, you can export them out to Excel just by clicking on this little icon here. And that's basically then replicated into Excel spreadsheet, which you could table if you wanted to, or graph, or whatever you need to do there. You can also delete the report by clicking on this button here, or alternatively within the results, just clicking on delete as well. Now, so that's the aggregate information from the contact log. You can also pull out a standard list of unit record data. So that's basically the raw data from each contact log. So to do that, you navigate to lists. The list type, so there's 2 different options. You've got contact details by person and contact details by contact. So by person, we'll sort of aggregate that information against the practice personnel member that's been assigned to the contact log, or contact details by contact is on a record by record basis for each contact log. So I'll just show you what I mean by that. So contact details by contact. Again, the only including report parameter here that's useful is this services provided option, which is persons with recorded contact note in report period. This is just using the generic sort of client case management terminology from SRS. But what that means is practice personnel with a recorded contact log in the report period. You can disregard the exclude file notes field. And then include identifier details. So that is if you want to include the name of the practice personnel that's in the contact log. So I'm going to include the identifying details in there, but you can choose to exclude them. Show in list, so only show structured data and dates in list, or show both structured and unstructured data. So structured data is all your select fields, your multi-select boxes, anything with a data set or a reference set behind it. Unstructured data is your free text fields and your integers and things like that. So I'm going to include everything and just show both structured and unstructured data. And then again, the period of interest, you've got some preset options, or you can basically select the specific start and end date. So I'm going to say today. And then you've got 2 options at the bottom here. So export list. That will automatically turn the list into a CSV file that you can export out into Excel, or view list, which means you can view it on page and then manually export it out to Excel. So I'll do both of them just so I can show you what the difference is here. If I navigate to the top results tab again, and click on My Reports. Now you can see the latest 2 lists that I ran. The first one is going to be exported straight out into a CSV file. And again, you can do whatever you need to do with that in terms of reporting, or you can view it on screen. So this is the unique contact log record that we created today. So you see that it brings up the personnel information because I chose to include identifying data. And then basically all of the fields that are on that contact log record are now included in the list with whatever values or free text you included, which there are quite a few of them. And this can also be exported out to Excel as well. Same method as what we did with the reports. And then I'm going to show you running that contact details by person list, what that looks like. So rather than having the sort of on a contact log by contact log basis, it aggregates the data. So if, for example, if there was a duplicate contact log record for Ruth Cook on today's date, and I'd selected all the same options, you would have, for example, 2 here, 2 here, 2 here. So this will basically show for each practice personnel member the aggregate information from the contact logs they've been associated with within the report period. And again, all of this information could be exported out to Excel and analysed that way. There is a custom list that's been currently written that will pull all of the information out specifically for the evaluation. And that will need to be generated the same way. So via the lists tab, there will be a custom list that you'll run for a report period, and that will be provided to the Sachs Institute for the evaluation purposes, and that won't include any of the free text fields or names of the practice personnel and things like that. Is there anything else you wanted to add, Sally, about reports and lists?
We've had one question around, and I think this is one that's a bit of a limitation that we're looking at developing, but about getting a list of contacts with a particular practice.
Yes.
So I know we can get that in that practice services screen. If you could just show people that again. And I think that can be exported, but I've tried it and there's a bit limited information. So maybe you could show them what's in that Excel. That would be helpful. Okay,
yep, no worries. So what Sally is referencing there is if I click on, if I want to look at all the contact logs for Albany Creek GP surgery, for example, I can click on this icon here, filter out all the contact logs, which is only one at the moment. If there was a list, obviously there would be if there were more than one being created, there would be a list of them. And then I can export it out to Excel here. However, the only information it's going to include is the date, the type, and the nature of contact here. So what you could do is it would involve, at the moment, a little bit of filtering. So you would run a list and do contact details by contact, persons with recorded contact node and report period, include identifying details, show both structured and unstructured data in list. And then I'm going to do a bigger date range because I know that there's lots of information that's been entered from the testing phase for the other practice and service records. So I'm just going to say this year and view list. Click on the results, view list here. Export it out to Excel. apply a filter, and there is a column for practice or service. So from here, so for example, this is other test data that other people have entered when we were going through the user acceptance testing phase. So if I wanted to see all the contact logs for Canberra Medical, I could then select, and then it will bring back all of the records or the contact records within the report period for that practice. Again, though, I do understand that's a limitation that you have to export out to Excel and then filter. But that is something that I think the Sachs Institute are looking at in terms of the potential for creating other custom lists maybe in the future that might be more useful or quicker to run for services.
Yes, it is. But that's really helpful. Thanks. I hadn't worked through to get to that potential interim solution at the moment, which is kind of good. So yeah, that would work for whichever bit of information that was wanted by including the identifying information. So that's been helpful as well. And I'll add that into the lists of the questions that we have at the moment. But yes, I have also circulated a while ago a sort of proposed list of the types of reports that we might try and ask about. And that would be really great to get some site and service feedback on. So I'll probably resend that out maybe early next week for people to start to try and have some input so that we can try and think through which we prioritise to be the reports that we'll actually then put in a request to get developed, because there is sort of a fee attached to doing that. So we just want to make sure that we're doing that as cost efficiently as we can. So yeah, we'll start that process to think about which reports might be the most useful. But I figure it'll be best once the sites actually have had a chance to start using it a bit as well and can really start to think that through a little bit. So that's a bit of a work in progress, that one.
Thank you. Well, I think that covers more or less the steps that I've set out in the user manual. So just to confirm, we talked through how to log in, how to change your password and set a security question so that if you want to reset your password, you can yourself. We talked through how to look at the practice and services that are already created within your cluster and how to create a new one. We talked around how to create a practice personnel member and then how to associate them with the practice or service record. We talked about how to create a contact log record and a planned activity, and then how to view those planned activities or a list of them that you've been associated with via the homepage My Actions tab. We also went through how to run a out-of-the-box report and an out-of-the-box list, how to see those results, how to export them to Excel and delete them.